Hi, I'm Dr. Lancelot Pinto. I'm a consultant pulmonologist at the PD Hinduja Hospital in Mumbai. Today, I wish to talk to you about HIV and TB, about co infections, and how to manage these in an optimal way. We know that HIV as a disease weakens a person's immune system, and tuberculosis, being an opportunistic infection, takes advantage of this weakened immunity and often manifests in individuals with HIV infections. What does this mean in terms of management? All individuals who have tuberculosis should ideally be screened for an HIV infection, and individuals who have an HIV infection should be periodically screened for tuberculosis, especially when the situation warrants it. A patient who is infected with HIV has a high probability of developing tuberculosis, both pulmonary as well as extrapulmonary, and we need to be on the constant watch for this. Pre test counseling, whether screening for tuberculosis or HIV, is extremely important to give the patient all the critical information that one needs to understand the situation better and help them allay their anxiety and fears. If a person has both HIV and tuberculosis, it is a difficult situation in terms of treatment and needs to be dealt with compassionately and sensitively. We need to allay the fears of the individual, explain and counsel the details of treatment to them, and make sure that they adhere to treatment. It is important to screen for multi drug resistant tuberculosis when it comes to treating tuberculosis, and treatment will often involve treatment for both HIV as well as TB, which may get complex and involve expertise. These adverse effects of treatment, combined with the stigma associated with both tuberculosis as well as HIV, can make patients reluctant to take their treatment regularly. It is therefore important to emphasize to them the importance of adherence, to reassure them as to how both diseases are easily manageable once they adhere to treatment and follow up closely. And it's also important to be compassionate and introduce them to peer support networks, which can help them with their journey of getting treated for the diseases. Remember that early diagnosis and empathy, counseling, and good management of both TB and HIV helps patients and reduces transmission in the community.